Male sexual problems can happen at a point in time, or even, over a prolonged period. In any case, you should see a doctor for all of them, since only a specialist can guide you and make the proper evaluation to determine the causes. In this article, we'll present 2 of the most common male sexual problems and what to do about them. Male sexual problems. Male sexual problems don't affect just the man suffering from them. They also affect his partner. Therefore, it's fundamental to count on the collaboration, understanding, and patience of your partner to be able to overcome them successfully. Inability or difficulty having sexual relations can be due to physical or psychological reasons. Even so, not being able to have sexual relations causes, at the same time, extra stress that can start a vicious cycle of feelings of guilt or disappointment which cause even more sex problems. Because of this, good sex therapy is important, preferably as a couple, so that the person suffering this disorder can get rid of their guilt and confront their problems. Erectile dysfunction. Stress is the main cause of erectile dysfunction, along with drinking alcohol and drugs. Erectile dysfunction is the inability of the man to achieve or maintain an erection, and therefore, sex. It's one of the most common male sexual problems, that affects many men at some point in their lives, even if it's just momentary. Normally, it's due to stress, tiredness, alcohol or drugs, etc. On the other hand, if it happens over a prolonged period, you should treat it, since it can seriously affect your relationship, work and social life, etc. There are various causes of erectile dysfunction. Psychological causes. Normally, these are the most common. Stress, anxiety, or depression can cause states of fatigue or lack of libido which lead to erectile dysfunction. Cardiovascular causes. Some cardiovascular disorders can prevent the penis from accumulating the necessary blood to achieve or maintain an erection. Among these problems it's worth highlighting hypertension, smoking, and diabetes. Neurological problems. Some conditions like multiple sclerosis, or spinal cord lesions can cause a nerve lesion that prevents erection. Finally, some medicines can reduce erectile functions. A good evaluation by a specialist is the key for your treatment. That way, they'll be able to determine if the cause is psychological, for example, depression, or of a different type, and take appropriate measures to treat it. Usually, after eliminating more serious problems and doing several tests, doctors advise psychological therapy. However, in some more extreme cases, the doctor might prescribe medicine like sildenafil or tadalafil, among others. We recommend you read 3 Female Sexual Problems and What to Do About Them. Premature ejaculation. Many bad habits in adolescence are related to premature ejaculation. Premature ejaculation is a very common male sexual problem in which the man ejaculates early and involuntarily, generally before penetration. This means, there's a lack of control over ejaculation. This problem, if not treated properly, can bring other problems, above all in self-esteem, and in your relationships and social life. Among the causes of this disorder are lack of maturity or sexual education, lack of self-esteem, anxiety, stress, extreme sensitivity, lack of satisfaction with your sex life, age, adolescence or old age. On the other hand, there are many types of premature ejaculation: primary, over a prolonged period of time, normally starting in adolescence, and secondary, just started recently. Treatment. In the first place, we should mention that there are exercises to increase control over ejaculation that are very effective. On the other hand, the treatment depends on the type and the causes. For this reason, it's important that you get evaluated by a specialist. In effect, you might need sex therapy. In cases of stress and anxiety, psychological therapy is essential. Additionally, many times premature ejaculation is due to bad habits acquired in adolescence. Effectively, young men, in their eagerness to achieve pleasure, don't acquire the control over their ejaculation, a problem they can bring into adulthood. Finally, in more extreme cases, a specialist might prescribe some medication. Effectively, there are creams and sprays that help to desensitize the penis, helping to delay ejaculation. In any case, these should always be prescribed by a doctor. You might be interested in how to help improve your partner's erection. Talk about your male sex problems. Sex therapy is an open route to correcting sex disorders in men and women. The male sex problems that we've mentioned, erectile dysfunction and premature ejaculation, are very common. However, a few of those affected have to see a specialist to treat them. Since there are many cases caused by psychological problems like stress, depression, or anxiety, avoiding those problems can worsen them. This can then bring you to a situation that could affect all aspects of your life and end in depression and unhappiness. For this reason, to achieve satisfactory sexual relations and maintain your quality of life on all levels, it's important to overcome any taboos. A specialist can help you talk to them about your problems. You don't have to get caught in a vicious cycle of unhappiness. There is a solution.